Welcome to the Sustainable Clinical Medicine podcast. I am your host, Sarah Smith. I am a practicing rural family physician and the charting coach. This is the podcast for physicians and advanced practice providers who are ready to step back from the busyness of their clinical day to share ideas, question everything, and redesign their clinical day. We are redesigning clinical medicine to create sustainable clinical days and create time for our lives outside of medicine. Join us for discussions with world experts who are helping design sustainable models of clinical medicine and the physicians or clinicians who have discovered or designed sustainable models of clinical medicine for themselves. Good morning, everybody, and welcome back. Today we have special guest Dr. Mitra Sadhu, who is here to talk to us about all the fun things that she's up to. Welcome. I'll let you introduce yourself.
Thank you so much for having me here, Dr. Sarah. It's a pleasure. My name is Dr. Mitra Sadhu. I'm a nephrologist down in Florida, and I run a lean private practice, working part-time and spending the rest of my time doing all the things I love. And I also try to create innovative solutions for my peers in private practice so that we may all thrive in these changing times in the healthcare industry. I'm married with 2 school-age kids. That's a little bit about me.
Beautiful. I speak to quite a few nephrologists, and what I know about nephrologists is they're typically very busy people because you've got a lot of very complex and long overtime continuity of patients. So tell us about how you got here. What was it that drove you into nephrology? What was your path leading up to this area where you got to be part-time?
Awesome. Yes. So my story is a little bit different from traditional. I did my med school in India and then my training, both residency and fellowship in nephrology at the University of Miami, Jackson Memorial Hospital. And after I finished training, I had my babies and wanted to spend some time with them. So I did not go back to work right away. I did some volunteering work in those years. And my husband is also a physician and a very busy subspecialist physician. So I was and still am the primary caregiver to the kids. And we also know a lot of physicians, both of us being physicians, everybody we know seem to be physicians. That, as well as all the groups that I'm part of on social media, I was noticing something. Everybody seemed to be burnt out. So as I was, thinking of going back to work, I'm like, well, it seems to be fairly certain that if I do the same thing, that the same thing's going to happen to me, especially with my roles at home and stuff. So I thought about it. And in the very beginning, I did some independent contractor gigs around town to keep my flexibility. And that was going great. But a few years into that, I wanted to do more. And as I was interviewing with other groups in town, I found that basically there are 2 choices. You either work 100 hours a week and get to the partnership track, or you work a couple of days a week and get paid for it, albeit highly discounted for that privilege, as has been well documented in several places. But there's no growth potential. You stay there. And I like to think that I have an entrepreneurial side, that ownership drives me, it motivates me. And so I kind of wanted to have my cake and eat it too. And it did not seem very likely with my interactions with other groups. So I was like, all right, I got to figure this out on my own. So I had 2 goals, right? I wanted to work part-time, and also I wanted to be my own boss and not have to ask anyone else permission for vacation. So it seemed like, okay, I'd have to start my own practice. Now, how does one start a practice and run a practice and be part-time with all the overheads that it entails? So that would mean that I would have to, well, you can either play the volume game, which I was not interested in, or you got to keep your expenses really low. And that is how the idea of my lean practice was born. It was a progression of sorts. It was not a pre-thought out, premeditated move. And I focused on the 2 biggest expenses for a small practice, namely office space and personnel. And I started out and still work out of a shared workspace location, thereby keeping my rent really, really low. And as for the staffing side, I started as a micro practice. I did all of it in the beginning, from answering the phone to getting prior authorizations to you name it. I still do the billing myself. I taught myself all of this. And the only thing that has changed is as the volume grew, I was finding that I'm spending evenings and weekends doing administrative tasks, and that was never the idea. So at that point, I hired a remotely located virtual assistant to take off the least desirable parts of the job. I took a good 3 months to train her, but now she is able to take care of so much stuff for me. It's amazing. So that's a little bit of yeah, of the not really before and after, but how I got to where I am. As for your question regarding nephrology per se, yes, you are absolutely right. Our patients are really sick, and a lot of times, and the continuity is really important. And this was all important to me as well. I wanted to have enough time to give to my patients because I never thought I would be the physician that I am capable of being if I see 30 patients a day. So I am fortunately able to give enough time to patients in the office than is usually considered feasible in a traditional insurance-based setting, only because of the low overheads. And so I see patients in the office a couple times a week on average. And yes, I am outpatient only. So I see patients in the office and do dialysis.
Nice. All right. Thank you so much for laying that out for us. I have so many questions. I'm going to
Sure.
start with going back to you were on maternity leave or you were looking after the kids and you noticed all the physicians around you were burnt out. What did burnout look like from your perspective, looking at them? What were you noticing that you were like, I don't want that? What was that kind of experience that they were telling you about or experiencing themselves that you were like, oh, I need to stay away from that. That does not look healthy, or whatever it was that was making you run the other way?
Right. A lot of it in my friends in real life um, were mostly the women physicians. A lot of us have traditional gender roles apart, from being physicians, and they were all having trouble maintaining those the way it felt right. I'm sure like they were taking care of their children and putting dinner on the table and all of that. It's just how it feels within us that is probably the most important piece of the puzzle. They complained about flexibility or the lack of it. Yeah, and yeah, the household responsibilities. Outside of that, and particularly on social media, the echo of disrespect and devaluation, and somebody with half your qualifications telling you how to do your job was, I think, the piece that just did not sit right with me.
Got it. Yeah. Okay. That's good insight because sometimes we can be curious about, well, would I look burnt out to Mitra if she was looking at me from where she was at that time? Like it's important to see it from maybe a different perspective because sometimes we don't notice it within ourselves as to what we're putting up with or having as part of our experience that may not be what you had looked at from the outside and said, I do not desire that. And so I'm just curious what that looked like. And then you went and interviewed with all the places that you could have been employed with your priorities in mind. So you're like, I want to still be a mom and I don't want to work having to see 30 patients a day. That's off the books. But then you had a comment about the part-time option. Tell us more about the part-time option that you were being offered and what that looked like in reality when you really pieced it out. What did part-time look like to you? What did you
Sure.
notice?
Sure. So, there's a great need in my specialty. So, finding a position was not the challenge. I had been in town, people knew about me. So that part was easy. Also, because there's so much shortage, groups were happy to have even a little bit of help. So they were like, if you want to do part-time, that's totally okay with us. It's going to help us at least a little bit, whether it's in the office, in the hospital, somewhere. So that was not the problem. I think from my perspective, it was just the lack of growth potential that was the issue, which is exactly what happened with the independent contractor gigs as well. I was enjoying those, and getting to do what I love. It's just that there wasn't more to look forward to. The other thing is, and this is again has been stated in so many places, that when especially a woman goes out looking for part-time work, um, then you do not get paid commensurate for the amount of work. For example, 50% is not usually 50% of compensation. It's less than that. Or on paper, it is 50% compensation and you end up working more than 50%. So all in all, it is a discount. In fact, even in Michelle Obama's book, Becoming, she wrote about the same thing when, as a lawyer, and she was an Ivy League trained lawyer. She had the exact same thing or she faced the exact same thing when she went talking to the law firms in New York City. So,
That's
so
very
yeah,
interesting. I hear a lot that physicians will say, I want 0.8 or 0.6 because that means that perhaps the work will get done in that full-time hours, but the spillover from the week is going to take
yeah,
up that day off, or
yeah,
that 0.4 or that 0.2 will be their overflow time. They're creating the administrative time for themselves, but at the loss of that income from
exactly,
it. Yeah, so
exactly.
that's what you're kind of saying. The under earning is immediately present.
Yeah, 100%. And for me, this was not a corporate employment situation. So it wasn't RVUs. It wasn't complicated. It was just the hourly rate or whatever the compensation given was like. Um, it was not commensurate.
Mm. Yeah, and then when you're doing that contract work and you're ordering labs, is it on you to check those labs that you've ordered, or did they have a process set up that somebody else would do those for you when you weren't there? What happened?
Right. So my independent contractor gigs were excellent. I was with a physician I loved, and no, I was not responsible for checking inbox, etc. It was actually only in hospital work. Well, one of them, the longer one. Yeah, so I was not responsible for it at the time. I will mention, however, that in my practice now, I am responsible for my own inbox, regardless of whether I'm off or not.
Yes.
But the funny thing is, it doesn't feel like a burden. And
Okay.
I wonder why that is. Is it
Yeah.
because it's my baby, it's my practice, and these are my patients, and quote unquote? And I was thinking about this because, yes, I do cover myself on my the rest of the week as well as when I'm on vacation. But it just feels like, I don't know, the right thing to do, or just part of the job, or whatever you want to call it. And not a burden. I think it's when a sense of ownership is missing,
Mm-hmm.
is when you feel unduly taken advantage of.
Yeah. Okay. Very interesting. Think when I've been speaking to doctors, I was even at a talk last night where I was talking to some of the family doctors here in Canada, but they have a solo practice or they're practice owners. And one of them has not had a day off for 18 months. Okay. Not had a day off because she's a practice owner and she's doing every component of the practice, including like the billings and the phone calls and the payroll and like all of the things, which is what you experienced when you first started this micro practice or this like owned practice. And it doesn't sound healthy for her right now with the volume that she's trying to put through in order to meet the overhead. So you've got some interesting ideas. You had a thought about how do I keep my costs down and what are my biggest expenses. Walk us through the how it doesn't feel like burnout, what you've done that's created for you space or priorities outside of that clinical day.
Absolutely. So I think we need to examine the why behind what we are doing. Um, my idea behind keeping overheads low was so that I could work part-time. So the work part-time was an important thing. And if I was, or when I got to the point because of the volume where I was spending evenings and weekends catching up on work, then that put me back to my why. Like, okay, that this is not part-time work. Let's get back to it. And also by then, some of the tasks that I really did not enjoy, I was willing to give up. Also, the idea of lean is not about cost cutting. Lean is, in fact, defined as a way of thinking of creating value with minimal waste. So the idea at every point, and I try in all my processes, is to look at waste and try and minimize it. It's not about cutting corners or simply cutting cost for the sake of itself. It's not about being penny wise and pound foolish. So some of those things I think have helped me get back to my North Star when things have shifted. In fact, at this time, I think the next step for me may be outsourcing some of the billing. I am wondering how to do it in a way that feels right. It's not that it's eating up, well, it's become my 80% now. At one point, it was a skill I learned and all of that. But at this time, it's just become a task. And as I want to do more in other areas, things I enjoy more, things that where I hope I can have more, give more value, that is something that will have to give way to something else. Um, so I think looking at or thinking about some of these things helps one to figure out how to run the business. But of course, the math has to math. But I would hope and assume and hope that a physician working so much is definitely bringing in enough to be able to support some of the at least the necessary ingredients to hire out or outsource.
Yeah, got it. Okay. So tell me about some of the things that you chose intentionally that helped keep your business lean.
Right. So outside of the two biggest costs, right? The office space. So it's a shared workspace that is not strictly medical. So I work alongside lawyers and therapists, and there's a chiropractor and a neuropsychologist and a couple of roofers. So anywho, and that is much lower rent than I could get on my own with an office suite in my neck of the woods. I'm in a very desirable greater metropolitan area. So that was one. The staffing was another. But also, like I mentioned, looking at every process and trying to make it more efficient. So the lean principles, interestingly, they come from manufacturing actually. Toyota, the Japanese car manufacturer, they came up with a set of guiding principles in the latter half of the last century, and those were then formalized into guidelines for their own company, and they turned out to be so successful that they were then adopted by other manufacturing units or companies, and has now spread to pretty much every industry. It's fairly nascent in healthcare, but I think it is just absolutely perfect for healthcare, especially with the challenges that we are now undergoing. Because the idea is to first define what your clients, or in our cases, our patients, find valuable. So, what are some things a patient might find valuable? Well, let's say maybe getting a first appointment in a reasonable time, being able to reach a practice without a 45-minute wait, an easy process when they come into the office with check in, check out, seeing the doctor without feeling rushed, getting their questions answered between visits, all of these things. So, these are the values we're trying to provide. Then we outline every step of every process that goes into delivering each of these value to the patients. And then you analyze it, you see what is unnecessary, where is a bottleneck, and you unclog that, you take out the unnecessary steps, and you make it as efficient as possible. Then you put it to the test and then come back to the drawing board and iterate. And you never get to destination. It is a continuous process. In fact, the Japanese have a word for it. They call it kaizen, which means continuous effort or continuous improvement. Right. So in trying to make my processes efficient, let's see, small things like phone calls. Even for the small patient base I have, I think I've been able to get down to fewer phone calls than average for a practice, because every time there is a phone call or there are repeated calls from different patients on the same issue or topic, I try to preempt it. I'll give you a funny example. In the very beginning, I'm in a big retail plaza, so there are several buildings, and the building number is unfortunately not very prominent. So people used to get lost in the parking lot. The GPS used to bring them to the plaza, but then they couldn't figure out which building. So when I got a few calls regarding this, I was like, all right, let me put it in the new patient text that we send them right after they've scheduled with my staff. A little spiel, not only with the address, but saying, hey, look out for the Starbucks. We're on the second floor of the same building. And that dramatically reduced the calls, the frantic calls from the parking lot. So little things like that. So every patient gets a text after they put down the phone that has the date and time of their appointment, so that we minimize the calls asking, hey, I forgot when my appointment is, or hey, send us your address. And it has the link to our registration forms as well. And most of the time, those are, those get done. So all of those steps are taken care of right then and there when the patient is first calling, and their information is received, and the insurance is verified, and they are all set for their first appointment.
Love it. That is so important, and just shows the higher level thinking that went into creating this sustainably, right? And you keep adapting it. That's what I love, is seeing this elasticity of, oh, I noticed that the patients keep calling from the car park. How can I preempt that?
Right. Right.
So help.
Absolutely. Right. And we can do this because, because I am a one person or two people operation. And that's why, and this is why also like private practices are set for success, because it's a kayak, not a cruise ship. So we can be agile, and we can maneuver whichever way we need to in these changing times. I think the most important equation is probably the mindset. We ourselves as practice owners and physicians need to probably be okay that private practice 2.0 or the practices of today and tomorrow need to look slightly different from something that is set up even like a short 10 years back. And even the rest of society needs to be okay with it. Our patients need to be okay with the fact that, okay, my doctor is in a shared workspace, but that does not diminish in any way the quality of care she gives me.
Yeah, tell us more about this shared workspace. This is kind of an interesting idea I've heard of from like you said, other types of industries, but not so much the medical. Like, are you dragging things around like your blood pressure cuff and things? Tell us more.
Absolutely. So fortunately, I don't need big equipment. Otherwise, it would not work in exactly the way I'm doing it. I have a briefcase where I have my laptop and some papers that I like to give blood pressure logs, patient instruction sheets, different conditions, how to do a 24-hour urine. So these are all folders. But yeah, all of it goes into a briefcase. Oh, and my most important equipment, my blood pressure machine. Yeah, so that way I'm portable, and I come in every day, and I am given a room. Sometimes I have to rearrange the furniture a little bit. There are desks and chairs, but I want to put it in a way that works for me. But that's about it. At the end of the day, I pick it all up and leave. So they let me know. Fortunately, the space comes with a receptionist, and they'll kind of let me know when a patient is there. So I go and get the patient from the waiting room, say hi, chat them down the hallway, so the small talk is out of the way. And as soon as we get to the room, again, we finish history and some of it. By the time their blood pressure is back to baseline, then I get their blood pressure and give them a plan. Yeah, pretty much all of it gets done in a very one-stop shop kind of way, because the plan is done, and then their next appointment, I just open up the calendar because the EMR is on cloud. So I just open up the calendar, give them an appointment in 3 months or 6 months, whatever is needed, and then escort them out. Sorry, if there's any patient responsibility, then I use a Square card reader on my iPhone, swipe their card, print their receipt, or email their receipt, and then send them back to the waiting room and say bye-bye at the elevator.
Love it. So what does an appointment length look like for you? What is the equation that has worked for you to feel this joy that I have enough time with my patients and I have enough balanced earnings for the type of overhead I have?
Excellent question. So I will usually schedule 3 patients per hour, and I leave a slot empty here and there. Maybe so instead of 6 patients for every 2 hours, I'll do 5. That way, if I run over on one, I'm not taking time away from someone else. Also, there are always either 1 or 2 no-shows or last-minute cancellations. And depending on whether I have somebody on the wait list who really needs to be seen, I'll either pull that person in or leave it empty, depending on how I feel the day is going to go. I also know the patients pretty well, so that also helps. And I think this gives me just a perfect amount of time, pretty much being able to answer their questions, not having them feel rushed. Our new patient appointment is 45 minutes. So yeah, between the two, I think patients have been pretty happy. And as for you asked about balancing it with earnings. So if we sit down and do the math, you'd be surprised. And don't burn me at the stake for saying this, but medicine still pays. I think if I were to draw an analogy from personal finance, it's almost like if you live way below your means, you feel rich. It's kind of like that. If you keep your overhead significantly low, then whatever you bring in feels not too bad. And yes, if you were to sit down and do the math, you'd find that very grossly, very roughly, one can make 6 figures with actually 1 day of work a week, averaged over 52 weeks. And this is simply for office visits. It's not even, we're not talking procedures and such. So yes, I'm, with a couple days a week or so, I'm fine. My overhead percentage-wise is less than 25%, and it keeps going down as the practice grows because, total minus overhead is profit. So it's working for me.
There we go. Okay, love it. Thank you so much for going into those like a little bit more specific numbers because it helps people kind of imagine, because imagining is difficult when you feel trapped or under pressure. So having that idea that there's other infinite possibilities about how we do medicine, and this is just another little imagination tickle, right?
Yes,
Love this.
100%, 100%. Thank you so much for bringing that up because yes, like you said, it is really hard to feel that there are options when you're feeling trapped. Also with the math, I think, kind of again, like personal finance, if you don't know, then you think you don't have options. It's the same with medicine. And I think it's just as important for employed docs to know the math behind what they make, because that will help them in knowing their worth and not only negotiating, but also realizing, oh my God, okay, I'm good with the amount of work I do. And if I do this on my own without the tremendous overheads the hospital has, then think of how much I can bring home. Right? Because a hospital's overhead comes from, or not the overheads, the expenditure comes from off your back.
Yeah, agree. Tell us about the noticing of things you weren't enjoying doing, and then that finding the person and onboarding them, and the decision that it would be a virtual person.
Right. So, not enjoying, that was easy. Some of it was some of the phone calls are always being available for a phone call, because then the off days did not feel so off if
Mhm.
I had to suddenly get all professional and answer the phone. That was one. Um, uh, Prior authorizations and faxing them back and forth and following up was another. Being on hold with insurance companies for denials was a big third one. So, what happened though, in me doing it for that long, was that I did learn some of the common reasons for denials, or even how to talk to the person at the other end that they would be more responsive. I'd be like, you know what, I really can't understand why this was denied. Please help me out. I saw this patient 6 months back for a service. I did the service. Please help me understand what I can do at this time to help this get paid. And the person at the other end is also human, so most of the time they did respond. So this helped me then train my VA in exactly like, okay, this is a little blurb of what has gone on with this denial, and I want you to ask this question, and this is how you ask it. So that really helps. Otherwise, yeah, because she had no prior training in this. As for training, yeah, it takes time. Because I used an agency that uses or gets people offshore, overseas individuals who work as healthcare virtual assistants. So they do have background training or even qualifications in medicine. Mine is an RN. So that really helps. However, if you want them to do things exactly the way you want to, and I guess by now you figured out that I like things done in a certain way, then that is going to take time.
Yeah,
Yeah.
this is really important. And was there a way that you were able to document this onboarding process so that the next one would be easier if you needed a second or a different, or she left because she, whatever? What did you think about for that point of view?
Right. Actually, she is my second. The first left in exactly 3 months after I had gone through the entire training process, pretty much. So I did two things. One, when we were chatting, I recorded it, the videos and screenshots and stuff. So that for the next one, I had her look at them so that my instructions on that was so much shorter than the entire length of the video. And number two, I had been writing all along very detailed policies and procedures. When I was like, all right, I can't do this anymore. I need a virtual assistant. Let me start writing. And so pretty much everything, phone calls, how I answer, and not only like how to get a prior authorization and stuff. So yes, we have a very detailed policies and procedures. And even now, we're always iterating. Anything falls through the crack, we're like, okay, why does this happen, or why did this happen, and what can we do? And then it goes into the policies and procedures as an addendum or an edit.
Love it. Okay, so this is that process, and this is that asset building for your business so that next time you onboard someone, it was much faster. I love this. This is things we need to think about as business minded owners of a practice, or even if you're employed but you're getting that high turnover, you
Exactly.
could do this for yourself because it's an investment in your time saving for yourself, for
Absolutely.
onboarding the next person. How do you do things? Even stepping back and thinking about, how do I do that so I can teach someone else? Because you might think everybody does it your way, but that's not true. You like it your way, and that's okay. It's just, how do you give that information to somebody without having to do the hand holding and the constant instruction and feeling as frustrated and spending as much time? Also important. Yeah.
Very true. Very true. And I think it helps the person onboarding as well. It's something they can refer back to, go through again if needed, instead of having to interrupt you. And they might be either hesitant to do that, and therefore just do it their own way rather than asking you for a third time how to do that thing. So yeah, I think it works both ways, and so true. It's just as equally important for employed docs as well.
Yeah. What was your requirements for a new patient? What did they have to think about bringing so that it would help you get that first visit done in that 45 minutes?
So I keep it easy for patients. I hope. So we send them the text that has the date and time of their appointment, our address, and the link to the registration forms. The registration forms are really easy. They're online. Yeah, they just submit it online. It comes to us, so there's no printing, none of that involved. Some patients, the octogenarians and nonagenarians, sometimes will do it in my office, and that's perfectly all right. What my VA will tell them is, hey, come in 30 minutes early to do the forms if you are not able to do it at home. So that's one part to it. Most of the ones who are referred by, say, primary care physicians or another specialist will have either notes or previous labs sent over. But at this point, I can actually get labs from pretty much all the sources or most of the sources where patients do labs, in at least in my area. It's either the two independent labs or the two hospital systems, and I have access to all of that. So we go in and pull prior labs so that the visit is more productive for the patient, because I am so data driven as a nephrologist. I need labs. Yes, so I like to get a bunch of old labs, see the progression of creatinine over the last 2 years or so. So yeah, the decision making is easier and it is more productive.
Got it. And when patients are coming in person with you, is there an expectation that they've done labs before they come for that appointment, or is that going to be organized during the visit? And what was your process with that?
Right. No, I do not ask for labs beforehand. Sometimes patients will not come for a visit, even though they have a referral has been sent on their behalf, and even if they've made an appointment. So no. Yeah, that would mean that me knowing their entire history and all of it before I decide on labs. So I order labs at the time of the visit to be done at an outside place. I don't have any way of doing labs at my office. And then I bring them in usually for the first visit sooner than it will subsequently be. So, for example, the bread and butter is chronic kidney disease for my practice. We do the entire set of labs that we need for chronic kidney disease and bring them back in 4 to 6 weeks, along with, say, renal ultrasounds. If they are doing well and have just CKD stage 3A, I don't need to see them every 4 to 6 weeks. That was just the second one. And then it gets spread out.
Got it. What about for those 3 or 6 month visits for your established patients? Is there labs before they arrive, or is that also negotiated at the visit?
Right. I ask them to do labs before they see me, again,
Okay.
for the sole purpose that it be more productive and we can take decisions at the time of the appointment. In fact, we have reminders for all of this. And right, I came to that as well once, the patients were showing up without labs and such. So a text reminder, we heavily use text or secure messaging. We use an app for secure messaging. If a patient does not download it, then we just text them with regular text. And we use this for our appointments and even most of our or a lot of our communication. Like, hey, we have an opening on such and such date. Say if somebody needs to get in early or something. So yes, we do a lot of the communication by text, because just like in my personal life, rather than pick up a phone, I'd rather text someone. It's the same with patients. It takes so much less time with messages rather than phone calls. And sorry, going back to the reminders, a reminder goes out 2 weeks in advance saying, hey, your appointment is coming up. If Dr. Sadhu ordered labs for you, labs or imaging for you, please, now's the time to get them done. That's it. And then in the week before the appointment, there are three reminders: day 7, or day -7, day -3, and day -1. Yeah, I've been able to reduce no-shows or late cancellations quite a bit, also with a policy of having a fee for no-shows or same day cancellations. And I don't charge it most of the time, but it acts as an excellent deterrent, because they don't know that I won't charge it, or I'll waive it for this reason and that reason and first offense and this and that. So it's so it acts as an excellent deterrent. Yeah, and that helps keep the schedule efficient.
Yeah. Okay. So texting is going to be more efficient and faster than phoning a patient. And Probably email as well, because email is something that they might look at not every day. Like we think emails are a daily, multiple times a day kind of inbox, but most of our patients do not.
That's right. That's right. So I used to do an email. However, to keep it HIPAA compliant, I had to pay for a service, and
Mhm.
I discontinued that service once I went on the secure messaging app because it works for communicating with patients as well as phone and fax, all of it. So it's a one all-in-one solution that I totally love.
Now, I know that right now checking your in basket each day is not a big problem for you and you're enjoying it. What if you wanted to have 30 days off? Have you considered that as part of your potential possible future? Yes, I want that. And how would you do it if you wanted it?
So, short answer is no, I do not have a solution for what I would do. However, I do take a lot of vacation. We go out every time the kids have time off from school because it seems that's the only way we can have daddy's time. Otherwise, if we were in town, he's working. So, I've gone out for as long as 3 weeks actually. We go home to India, and that's usually a long trip. Now, it's not hard. Internet is fairly ubiquitous. If it's not, I'll buy, a personal hotspot kind of thing. Plus, my phone has hotspot. So as long as I have internet access, I can check my inbox. And what I do is I'll usually do beginning of the day and end of the day. So I'm an early riser compared to my family at least. It takes me about 20-30 minutes in the morning to having my coffee while the others are still sleeping, and I address the urgent things. For me, it's mostly labs, lab results. I don't want to miss anything critical. I've sent a patient to the ER while I was at Yellowstone. So as long, all right. So I look at the labs. I tag my virtual assistant for whatever needs to be done. New patients that need to be scheduled. Most or a lot of other patient messages get an automated response while I'm away, saying that the doctor is on vacation and will address your needs when she returns. If it's an emergency, please seek emergency medical care. Um, some of it is refills, and I do that because I don't have to. Refills are not an emergency, but again, I am. It doesn't take me time or bother me, so I do most of it. And yeah, I've been able to manage this way.
Yeah, that's okay. That is okay. This is your business and your baby, and you get to do it however you would like to. I'm curious though, if we've got this system where there's these shared rooms, I wonder if there's room for shared practice, right? So shared holidays. If you can find another nephrologist in the world who could like do this space share with you, if that's another potential. We know that even solo general practice or family practice in Canada, you can find another solo family practitioner and just be your buddy. I was talking to one of the older, now retired family doctors here in Edmonton last night. He was a solo doctor and he had a room next door to another solo doctor, and they shared that they had keys to each other's clinic. They had access to each other's EMRs. They would see each other's patients when they were out of commission, whether on holidays or during medical illness. And I thought that is so fascinating that you're doing it your way. It's your business, it's your patients, it's your baby, but there's also this buddy in the world who can be your other, which was fascinating to hear that even like the practice started 45 years ago, that this was a possibility even then. Like, wow, just that imagining outside the box. If I wanted to create, what would that look like, or how could I start to think about that? Just as some ideas. I get worried for my solo practitioners too, right? That
Right.
at some point this might not feel as sustainable, and now what? So not you, you're feeling great, but some of the listeners might be like, but here's the thing I have to worry
Absolutely.
about. I want to,
Right.
climb
Right.
Mount Everest where there's never going to be internet. Now what?
Right.
How would I do
Right.
that if I wanted
Absolutely.
to be in this amazing micro practice that you've set up? Super helpful. Is there anything else that, or where can people find you if they're kind of interested in some of the things you're doing and learn more? How would they find you?
Absolutely. So they can find me either through Link Medical Spaces, which is a brand new venture. And just share a line about it. So it's an online platform where one can list available medical office space if you have any, so that others may find it, healthcare professionals of any kind. And I think it's great for people who are trying to start up practices with a lower overhead by subletting office from an established practice instead of going out and buying or renting full office suites. So I can be reached there at hello@linkmedicalspaces.com. And I also blog at leanprivatepracticesolutions.com. And my email there is editor@leanprivatepracticesolutions.com. So I'm also all over Facebook on with my name, Mitra Sadhu. So I am not hard to reach.
Love it. That's so fun because people can then learn from you and all of this wisdom and entrepreneurial insight that you have gained over the years as you've set this up. It's really fascinating and really important that you kept your priorities so North Star for yourself. Is there anything we didn't talk about that you think would be helpful to listeners?
I think we got most of it. I just want to again reiterate that these are challenging times. There is no denying that, but sometimes the best comes out of need in such times rather than when the going is good. And we're a bunch of really smart, really resourceful people. So if you back us into a corner, we are going to find our way out of it. It's going to take some unique solutions, maybe. So things, and also like the changes may be small on an individual level in the beginning until they coalesce into bigger changes, and all of this until the big systemic changes that we're all hoping for can come about. So yeah, there's light at the end of the tunnel.
I love that. Thank you so very much, Mitra, for being with us today and giving us a little bit more imagination to work with about how we could redesign some of the things that we're doing within our practice, even if we're not wanting to be solo practice, to some of the things that we could make easier on ourselves or more streamlined or save us some time or some extra questions for patients.
Yes, absolutely. In fact, thank you so much for bringing up this point, because I like to say this is my version of lean. Your version may look completely different. You may be a giant practice with several physicians and staff and multiple locations, but lean is a way of thinking. You can run it efficiently and run lean, even though you are so big. So it is not limited to any one kind of vision.
Perfect. Yeah, absolutely. I think that's really helpful, that we can create lean and stop doing things that we don't need to be doing, redesign how we're doing things so that it's easier or less complicated or whatever that looks like to create lean for you. So thank you for this wonderful conversation.
Thank you, Dr. Sarah. It was truly a pleasure. Thank you for all you do.
Bye, guys. Right, everybody, you have a workshop coming up. Stop hating clinic days. You know, this is my jam. I love helping you with your clinical days and your clinical day efficiency and looking after you within your clinical day. No one else will respect your time. This is all about you and how you work within your clinical day, giving you some strategies for how to manage the task load of the day, improve your workflow, consider other ways to help you within the clinical day. Make sure you sign up for the workshop. It's available right now to register, and we will see you there. This will be interactive, give you some strategies to have that you can put into place immediately, some ideas for bigger systems and processes, and some longer term priorities for yourself. Join us then. I will see you there. Looking forward to it. Bye, guys. Thank you for being part of the Sustainable Clinical Medicine podcast. If you'd like to learn more or join us to help you get home with today's work done, go to chartingcoach.ca. There you'll find all the information on the Premier Lifetime Access Charting Champions program that is helping physicians get home with today's work done, with all the proven tools, support, and community you need to create time for your life outside of medicine. We would love to see you there. Until next time, thanks for listening.